nerve supply of the hand. In nerve supply, this is movie number 1. In nerve supply of the hand, we have mainly 3 nerves which reach the hand. Only 3 nerves of the brachial plexus that supply the upper limb will reach the hand. Namely, the ulnar nerve, the median nerve, and behind is the radial nerve. So 3 nerves reach the hand. In the anterior surface of the hand, we have 2 nerves. In the posterior surface, we have only 1 nerve. In the anterior surface, we are going to start to talk about the ulnar nerve. As we said, the ulnar nerve which lie ulnar side or medial side to the ulnar artery. This is the ulnar nerve, and enter the wrist to pass superficial to the flexor sternocleidomastoid outward from the carpal tunnel. And when it enter the wrist, it also still, like in the forearm, lie over the medial side of the ulnar artery. The ulnar nerve over the medial side to the ulnar artery. The ulnar artery is radial or lateral to the ulnar nerve. It pass. Here is the pisiform. You can feel it here. If you press here, you can feel a protrusion of bone. This is the pisiform. So the nerve lie lateral to the pisiform bone. And here is the hook of the hamate. So it passed between the pisiform and the hook of the hamate, both of ulnar artery and ulnar nerve. Enter the wrist. Once enter the wrist, the ulnar nerve will be divided into 2 terminal branches. When I say terminal branches, mean this ulnar nerve, which come from above this ulnar nerve, is aimed at the wrist as the median nerve, while the radial nerve and the radial nerve trunk end at the level of the elbow. So both of these nerves end here, while the radial nerve end in this level. To continue talking about the ulnar nerve here, once it's enter between the pisiform, lateral to the pisiform, and medial to the hook of the hamate, it entered the wrist and then divided and terminated to 2 terminal branches, the superficial branch and the deep branch. Superficial branch is less important, but it usually, mainly it's cutaneous. It gives cutaneous branches and muscular branches. The muscular branches, which is not seen here well, the muscular branch is given to a muscle, very small muscle here. We call it the palmaris brevis. This is the palmaris longus. This is palmaris longus, and here a small muscle in the palm, we call it palmaris brevis, supplied by the superficial branch of the ulnar nerve. The cutaneous branches of the superficial branch, the cutaneous branch will supply the anterior or palmar surface of the little finger and palmar surface of medial side of the ring finger. It also extend backward to supply dorsal surface of the little finger up to the middle part of the finger, and half the medial half of the dorsal surface of the ring finger. So the cutaneous branches of the ulnar nerve supply 1 finger and half. 1 finger and half, which is the little finger and the ring finger. So cutaneous branches supply 1 muscular to palmaris brevis muscle here, and cutaneous branches to the palmar surface of all palmar surface, and half of the dorsal surface for the little finger, and the medial half of the ring finger. This is the superficial branch. What about the deep branch? Deep branch is more important. The deep branch will pass deeply to reach the metacarpal bones, and it will. This is the deep palmar arch. Here, the level of the deep palmar arch. This is the deep palmar arch. It will curve with the deep palmar arch within the concavity, not over the convexity, but within the concavity of the deep palmar arch, which is a continuation of the radial artery. So here is the deep palmar arch. This is superficial palmar arch, but deeply here is the deep palmar arch. In this position, the deep branch of the ulnar nerve will curve within the concavity of the ulnar deep palmar arch. The deep branch of the ulnar nerve will give muscular branches. The muscular branches will be to the 1 flexor digiti minimi, 2 abductor digiti minimi, 3 aponius digiti minimi. So 3 thinner muscles supplied by the deep branch of the ulnar nerve. We have also the 3rd and 4th lumbrical muscles. We have the anterior palmar and dorsal interossi. Palmar dorsal interossi, the palmar cannot be seen. 4 muscles, palmar interossi muscle cannot be seen here. And we have the 4 dorsal interossi. This is the first dorsal interossei, this is the head, and this is the head of the first dorsal interossei, the second dorsal interossei, the third dorsal interossei, and this is the fourth dorsal interossei muscles. All are supplied by the deep branch of the ulnar nerve. And also the adductor pulses supplied by the deep branch of the ulnar nerve. So this is the ulnar nerve, and after enter the wrist to superficial branch, supply cutaneous branches to the and palmar surface of the little finger, and medial palmar surface of the medial half of the ring finger, and these both of them extend to the posterior up to the middle of the posterior surface of these fingers. This is superficial branch. Also superficial branch will give to small muscles here superficially, which is the palmaris brevis muscle. The deep branch is more important, supply all three muscles of the, it is only muscular, supply all three muscles of the hypothenar, and the fourth lumbricals, the third lumbricals, all palmar interossei 4, all dorsal interossei 4, and the adductor pollicis muscle. These are the branches of the ulnar nerve here. Nerve supply of the hand. Nerve supply of the hand, movie number 2. Remember,